Welcome, everyone, to the Enhancing Clinical Practice and Outcomes stream of SNOMED CT Expo 2024. My name is Monica Harry. I am the Director of Content and Mapping at SNOMED International, and I'll be moderating this afternoon's session. Just note all questions, if you could hold those until the end of the presentation. And for people online, please, you can use that Q&A button to type your questions, and then I can read them out for you. And note in the room, if you have questions at the end, I'll give you a microphone so that people online will be able to hear your questions. I'm now pleased to introduce Jasna Karacic-Zanetti from the Health Diplomacy Unit, Brussels, who will present diplomatic strategies for enhancing SNOMED adoption in healthcare systems. Go ahead, Jasna. Thank you.
Thank you. Hello to everyone. So I cover 3 countries, actually, Belgium, Croatia, and Italy in my diplomatic work. And I was served as a health attaché during the COVID pandemic in the Council of the European Union. So it was very challenging, and I will try to show you some examples and something what maybe you can take home. Maybe you are not so familiar with the diplomatic work and etc., but it's very, very common, and you can see later that SNOMED also can be very, very useful for in diplomacy. Here. Okay. The healthcare data standardization gap is a critical challenge for health diplomacy and political initiatives, as the lack of unified terminology hinders international cooperation, policymaking, and the coordination of public health measures. This gap hinders data interoperability, clinical communication, and patient care. So in the realm of healthcare diplomacy, this lack of medical terminology, such as SNOMED, hampers international cooperation and policy-making efforts by limiting data interoperability and compromising public health initiatives. That was very, very interesting in the COVID pandemic. Bridging this gap through widespread adoption of SMED requires diplomatic engagement and political engagement, of course, consensus as well, to align diverse stakeholders, assuring that global health systems can fully leverage the potential of shared accurate clinical data. So during the COVID-19 pandemic, the lack of this terminology that is unique hindered international cooperation and policy making by limited data sharing on symptoms, testing, and treatments. You saw that, I'm sure, that it was really problematic for the worldwide. This slowed these global responses, such as travel restrictions, vaccine distributions as well, and you know this famous passport, COVID passport. A diplomatic strategy focused on adopting SNOMED could have facilitated seamless data exchange, enabling more effective collaboration on public health measures and improving global pandemic management. Today, for example, we have monkeypox. So I was in the ACDC last month, and we discussed about the potential of the monkeypox, maybe that can occur in the some period of time. So lesson learned from the COVID-19 for diplomacy. It's obviously it's different than hospital settings, but we still have something together because COVID highlighted these critical failures in global health diplomacy, the lack of this standardized communication and data sharing among the countries, especially about testing and vaccines and the COVID passports. So for the future, for example, if monkeypox happens to be on the critical alarm level, SNOMED can play a pivotal role in enhancing emergency preparedness by providing this standardized framework for clinical terminology that facilitates accurate data collection, sharing, and analysis. By ensuring that healthcare providers and public health officials use a common language, then SNOMED can improve interoperability among healthcare systems, enabling timely and effective response to emerging health threats. The adoption, of course, of SNOMED can enhance this awareness during crisis. Of course, even war crises such as Russia and Ukraine, supporting better decision-making process. The potential, this is in the general potential of the SNOMED. If we talking about diplomacy, what is very interesting to be focused on the patient outcomes and healthcare efficiency. So the patient outcomes is always what is important, of course, for clinicians, but also for us in diplomacy. It's important patient outcome, like something if we do some protocols, measures, and then outcome of this for the patients is always that's why I like research and evidence-based, because if I do some research, what I did previously in COVID, and then I have results what are evidence-based, then I'm sure that I can make based on this some protocol of guidelines that I can present to Minister of Health and say, okay, this really works. So then this can be one of things what is the really useful. Challenges to SNOMED adoption, there are a lot of challenges because with my colleagues, when we discuss about SNOMED, so they are not so familiar with the SNOMED. Even maybe you are not so familiar with the diplomacy. So there are two different things, but definitely there are something that can be used together. There are many barriers in healthcare systems, as we know. Complex terminology, what we also heard in the lecture before, high implementation costs, that can also be one barrier because not all the countries are not in the same position to be on membership or have to access to the good library and these things, and also fragmented healthcare landscape. Diverse practices complicate also adoption because we have some differences between culture, between the measures and everything. So stakeholder priorities and concerns are also something what is very important. We have different interests in the stakeholders. So because we have, for example, patient organization and the priorities are different because we have diabetes association, then we have I don't know, migraine association, and they have other priorities in healthcare that they want for their patient. So we have also clinicians, healthcare providers, administrators, policymakers. They have also some different needs than associations. And then it's very important to have in mind to addressing these concerns is a key to achieving widespread adoption. We need to think about everyone. So not only clinicians, not only politicians, patients, but everyone in this bubble. We always in Brussels, we're talking about Brussels bubble, about decisions, but here we can say SNOMED bubble, like, and the diplomatic approach to this SNOMED adoption is collaboration and consensus building. These are essential, absolutely, consensus building. We need to have this. Focus on addressing the needs and priorities for all stakeholders also. These are diplomatic strategies. Benefits occur. We have key advantages of SNOMED adoption, improved data sharing, seamless exchange between healthcare institutions. This is also something what is also concerned today about patient rights and patient privacy, because we saw some gaps in the hospitals that each doctor that work in the same hospital can access to the patient data. Even patient, for example, he or she was treated in the psychiatry department, and then it comes to gastroenterology, for example, that gastroenterologist can see the data of the psychiatrist. What is maybe today a big challenge to see how to limit in some way this kind of data. Even today we have some regulation about that, but it still is not effective, let's say, because it's maybe online, like cross-border healthcare, online patient summary, for example, you can limit some access, but in the same hospital, even nurse or doctor can access the file. So accurate clinical reporting also. and enhance decision support, better information at the point of care. Engaging clinicians. Always what I like to do, I like to ask my friends, for example, or any clinicians in the hospital, how is the situation? For example, in the COVID, I ask actually every day, how is the situation today? Do we have anything what we need to think about it? What is the problem that you want to address to politicians? And of course, you know how I also worked previously at the ministry, and it's always like if you're on the top like a minister, there is always like I don't want to listen clinicians because and it's not a good way, because if we want to do some changes and to make something better, then we need to listen those who work directly with the patients. So patient-doctor relationship, we need to have always this in mind. Engaging clinicians effectively involves a combination of these strategies tailored to their needs and interests. So this is the very important, and this is key approach. I will not read all of that, but everything is linked to quality improvement. So if we want to quality in healthcare, we need to listen clinicians. Of course, engaging healthcare providers, we have university hospitals, we have private hospitals, and it's important to spread the word about in all providers. This is also a very important thing, because we know that mostly the most important things are focused on just for university hospitals, yeah. But for the cost of saving of cost and everything else, it's very important. Engaging policymakers. Usually, it's always the first thought is a WHO, but there are also included all policymakers that can be, and that is very important. We need to support of policymakers for the SNOMED adoption as well, and that's I saw here that also the representatives from Ministry of Health also in Korea, and that is a very good thing, and I think this is the best of the what we can do. To engage policymakers effectively, it's crucial to communicate the potential and in improving population health outcomes and public health surveillance. And fostering ongoing dialogue, it's always important. So not one direction, but dialogue. So we need to also have a feedback, not only one direction. So joint efforts between organizations, vendors, professional bodies, always it's a collaboration for the share best practices as well. We saw here consensus through collaboration. It's always important. In the moment, I'm trying to see also consensus with the Delphi, and how to implement this in diplomacy, because I think that consensus is always important. And phased implementation, such a pilot programs, it's important to follow from the beginning to the end, and capacity building, training, and skills development also something what we need to be aware of it. Then we have electronic health records. I told already what is the gap. The gap is that right to the privacy. Right to the privacy is still something. I also don't know how to do it. But actually, if you're a patient in one hospital, you can have access to the timeline of the access of all doctors that they have access to your records in the hospital. So that is the one good thing. So you can simply ask the hospital, I want to see timeline and all access to my file. This is the moment only thing that we have, and I hope to have some new ideas how to change that. Ongoing support of implementation, it's always one journey, so it's not something what can be done in the moment. In conclusion, I will repeat collaborative phase approach. So collaboration, dialogue, it's very, very important. Diplomatic strategies and collaboration pave the way of the SNOMED adoption. Stakeholders engagement, capacity building, and pilot programs drive success. Also, previously we heard about terminology, what patient can understand. But I have a name for this. This is a health literacy. So health literacy is the term what patient can understand about their medical records, about the words that are simple. This is the health literacy, and they're essential for improving healthcare communication and outcomes. And SNOMED provides standardized medical terminology, while health literacy ensures that individuals can effectively understand and use digital health information, enabling more accurate data sharing and informed decision making. This is the one thing what I want that you take home. Informed decision making. So I know something and then I can make better decision for my health with clinicians. Health literacy then refers to the skills and knowledge individuals need to effectively seek, understand, and utilize health information from electronic source. If a patient know what is the health literacy and know how to use it, then you will not have, for example, in emergency department, so many patients that they have only, I don't know, the tachycardia because they are anxious. They will know that this is the something about that, and that then they don't need actually to go to emergency about that. Moving forward, so improve healthcare standardization, data with the clinical communication, and enhance patient care and support health goals. The adoption of SNOMED is crucial for improving data interoperability across healthcare systems, enabling seamless communication and collaboration among clinicians, patients, and public health entities. By standardizing medical terminology, SNOMED has clinical documentation accuracy, support better decision-making, and ultimately leads to improved patient outcomes and more efficient public health initiatives. That's all from me. Thank you.
Thank you, Jasna. We'll now take questions. Anyone in the room have a question? Okay, I'll bring the microphone. Hold on.
Thank you. This is Frank from the NRC in Germany. Thank you for your talk. You said it in your presentation that involving clinicians is really also one of the key points in adopting SNOMED CT in your country. What would you tell clinicians really if they come to you and ask what SNOMED CT is all about and why they should use it and why they should be involved?
Because simply, we will have better patient outcomes. It will be easier first to work, to manage patient diagnosis and the treatment. And I think it can be less mistakes and less medical errors, maybe even that. I don't have still evidence base for that. But in my opinion, if we follow that, maybe it can lead to less errors, and there is a benefit for the patient.
Thank you. Thank you. Thank you for a very interesting talk. And it's really great to hear that there's somebody at Mission Control championing SNOMED. My question is there a way that you've developed or Brussels has developed to track which diplomatic effort is most effective and which works in one jurisdiction but won't work in another? How do you deal with those kind of issues?
This is very interesting. So we have what is the name? Permanent representative of each country to the European Union, for example, if we talk about European Union, but I have my colleagues in the Washington, D.C. also, so that they cover states. And I think over the world, there are missions, diplomatic missions to some other country, where especially where is United Nations representations are. So it's very interesting because this is the actually a discussion on the General Assembly, on the United Nations. And it can be maybe one of the topic, maybe even I can suggest for the next General Assembly in Geneva at the United Nations to discuss this, how we can maybe improve even this communication between the embassies to see how to implement better SNOMED. Is there any key maybe to put it like something official in the, or for at least for health attaché. Health attaché is the person responsible for the health diplomacy, like I was, and that is something maybe that can be one of the working template. Yeah.
Thank you very much. Anybody else want?
Any other questions?
Oh, no. Have a go.
Okay, thank you, Jasna. With that, we'll conclude the session. And thank you to all the delegates and attendees. The SNOMED Expo 2025 will take place in Antwerp, Belgium, and we very much hope to see you there. Thank you, everybody.